Obesity is a medical condition in which excess body fat has accumulated to the point where it may have a negative effect on health. Obesity can lead to a number of serious health problems, including cardiovascular disease. Obesity increases the risk of developing heart disease, which is the leading cause of death worldwide. Excess weight puts extra strain on the heart and can lead to high blood pressure, high cholesterol levels, and heart attacks. Type 2 diabetes. Obesity is a major risk factor for developing type 2 diabetes, which is a chronic condition that affects the body's ability to use insulin properly. Obesity can cause insulin resistance, which means the body cannot use insulin effectively to regulate blood sugar levels. Respiratory problems. Obesity can cause breathing difficulties, especially during sleep. This is because excess fat in the upper body can compress the airways, leading to sleep apnea and other breathing problems. Joint problems. Obesity puts extra stress on the joints, which can lead to arthritis, joint pain, and decreased mobility. Cancer. Studies have shown that obesity is linked to an increased risk of several types of cancer, including breast cancer, colon cancer, and prostate cancer. Mental health issues. Obesity can also lead to mental health problems such as depression and anxiety. Liver disease. Obesity can lead to the development of non-alcoholic fatty liver disease, which is a condition where excess fat accumulates in the liver. This can lead to inflammation, scarring, and liver damage. Kidney disease. Obesity is a risk factor for chronic kidney disease, which is a condition where the kidneys are not able to function properly. Obesity can lead to high blood pressure and diabetes, which are both major causes of kidney disease. Reproductive health problems. Obesity can lead to fertility problems in both men and women. In women, obesity can cause irregular periods and infertility, while in men, it can lead to decreased sperm count and erectile dysfunction. Gastrointestinal problems. Obesity is linked to several gastrointestinal problems, including acid reflux, gallbladder disease, and hernias. Sleep apnea. Obesity can cause sleep apnea, which is a condition where a person stops breathing for short periods during sleep. This can lead to poor sleep quality, daytime fatigue, and other health problems. Stroke. Obesity increases the risk of stroke, which occurs when blood flow to the brain is disrupted. This can lead to brain damage, disability, and even death. Skin problems. Obesity can lead to a variety of skin problems, including acanthosis nigricans, a condition where patches of skin become darker and thicker. Chronic inflammation. Obesity can cause chronic low-grade inflammation in the body, which can lead to a variety of health problems, including heart disease, diabetes, and cancer. Mental impairment. Obesity is linked to cognitive decline and impaired mental function in older adults. This can lead to problems with memory, attention, and decision-making. In addition to the physical health problems associated with obesity, it can also have a negative impact on mental health and quality of life. Obese individuals may experience discrimination, stigma, and low self-esteem, which can lead to social isolation, depression, and anxiety. Therefore, it is important to address obesity as a multifaceted issue that requires a holistic approach to treatment and prevention. Venous insufficiency. Obesity can cause venous insufficiency, which is a condition where blood does not flow properly through the veins. This can lead to swelling, varicose veins, and skin ulcers. Infertility. Obesity can cause infertility in both men and women. In women, obesity can lead to irregular periods and ovulation problems, while in men, it can lead to decreased sperm count and motility. Osteoarthritis. Obesity is a major risk factor for osteoarthritis, which is a condition where the cartilage that cushions the joints wears down over time. This can lead to joint pain, stiffness, and decreased mobility. Asthma. Obesity is linked to an increased risk of asthma, a chronic respiratory condition that causes inflammation and narrowing of the airways. This can lead to wheezing, coughing, and shortness of breath. Dementia. Obesity is a risk factor for dementia, a group of conditions that affect memory, thinking, and behavior. This can lead to problems with daily activities, social interactions, and overall quality of life. Pregnancy complications. Obesity can cause complications during pregnancy, including gestational diabetes, preeclampsia, and preterm labor. These complications can affect the health of both the mother and the baby. Chronic pain. Obesity can cause chronic pain, which can affect various parts of the body, including the back, neck, hips, and knees. Sexual dysfunction. Obesity can cause sexual dysfunction, including decreased libido, erectile dysfunction, and difficulty achieving orgasm. Social and economic consequences. Obesity can also have social and economic consequences, such as discrimination, reduced job opportunities, and increased healthcare costs. Lifestyle changes. Making changes to diet and physical activity can help manage obesity. This may include eating a healthy diet that is rich in fruits, vegetables, whole grains, and lean protein, and reducing intake of sugary and fatty foods. Regular physical activity, such as brisk walking, cycling, or swimming, can also help manage obesity. Medications. There are several medications that can help manage obesity by reducing appetite, increasing feelings of fullness, or preventing the absorption of fat in the body. These medications should be used under the guidance of a healthcare provider. Bariatric surgery. Bariatric surgery, such as gastric bypass or sleeve gastrectomy, may be an option for individuals with severe obesity, who have not been able to manage their weight through lifestyle changes and medication. Bariatric surgery works by reducing the size of the stomach, which can lead to significant weight loss. Behavioral therapy. Behavioral therapy can help individuals identify and change unhealthy habits related to eating and physical activity. This may include setting goals, tracking progress, and developing coping strategies for dealing with stress and emotions. Here are some strategies that can be effective in managing and overcoming obesity. Eat a healthy diet. A healthy diet that is rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help manage obesity. It is also important to limit intake of sugary and fatty foods. Exercise regularly. Regular physical activity, such as brisk walking, cycling, or swimming, can help manage obesity by burning calories and improving overall health. Consider medications. Medications that reduce appetite, increase feelings of fullness, or prevent the absorption of fat in the body may be an option for some individuals with obesity. These medications should be used under the guidance of a healthcare provider. Get support. Having support from friends, family, or a support group can be helpful in managing obesity. Finding ways to manage stress, such as through exercise, meditation, or counseling, can be helpful in managing obesity. Get enough sleep. Sleep is important for overall health and can also play a role in managing obesity. Lack of sleep can disrupt hormones that regulate appetite and metabolism, leading to weight gain. Develop healthy habits. Overcoming obesity requires developing healthy habits that can be sustained over the long term. Setting small goals, celebrating successes, and finding ways to make healthy habits enjoyable can all help in staying motivated. Avoid fad diets. Fad diets may promise quick weight loss, but they are often not sustainable and can be harmful to overall health. Instead, focus on making gradual and sustainable changes to your diet and physical activity habits. Surround yourself with supportive people. Having supportive people in your life can help keep you motivated and accountable in your weight loss journey. This may include friends, family, or a support group. Be patient. Overcoming obesity takes time and patience. It is important to remember that weight loss is not always linear and may involve setbacks along the way. Staying positive and focusing on progress rather than perfection can help in staying motivated. Focus on sustainable changes. Sustainable changes are those that can be incorporated into your lifestyle long term. Rather than focusing on extreme diets or exercise regimens, focus on making small, sustainable changes to your eating and physical activity habits. Find activities you enjoy. Physical activity doesn't have to be boring or painful. Find activities that you enjoy, such as dancing, hiking, or swimming, and make them a regular part of your routine. This may include meal planning, scheduling exercise sessions in advance, or packing healthy snacks to take with you on the go. Be kind to yourself. Overcoming obesity can be a challenging process, and it's important to be kind to yourself along the way. Remember that setbacks are a normal part of the process, and that small, gradual changes are still progress. Remember to seek medical care if needed, to focus on making sustainable lifestyle changes rather than quick fixes. Thanks for watching.